Right, so this evening's FredTalk, as we like to call it. Our wonderful presenter is Dr. Flävio. He's an orthopedic surgeon in Curitiba in Brazil.
Yeah.
Got it. Okay. We met a couple of years ago when he came and did a course with us in, was it Belo Horizonte, when we first met, I think. And so we've been knowing each other since. I consider him to be my hypno son. He considers me to be his hypno father. And we've had this friendship ever since. And he is a fantastic man. And he uses these hypnotic techniques now in his work as an orthopedic surgeon in pre and post operative care. So I'm going to hand you over to Dr. Flävio. You're going to have a wonderful time. You're going to learn some wonderful things from this beautiful man. And I look forward to it myself. And I'll come back in later on, maybe an hour from now. But as I said, there's no time limit. And if you want to take questions, you can open it up to Q&A. Okay? So all the best. And I'm looking forward to this. And I'll speak to you in a bit. Bye for now.
Okay. Thank you, Freddy. Thank you, Freddy. So, nice to meet you, everybody. My name is Flävio Grzybowski. We have some problems. We talk about my last name because it's Polish thing in here, Brazil. We talk in different. So my name is Flävio Grzybowski. So I'm an orthopedic surgeon here in Brazil. And I will talk about post-operative care and about how hypnosis can be used in medical care, in medicine care. So for me, it's very important to talk about it because here in Brazil, we have a lot of preconceptions about hypnosis. So for me, is a good opportunity to talk about it, you know. So just sorry about my English because it's not my first language, okay? So sometimes I just forget some words, but I will do my best to make all of you understand what I say, okay? So let's start it. Well, the first thing I want to talk about with you is about medical care, the view of medical care in the world. You know, we have a medical care in Europe, in USA, and here in Brazil and all South America and India and other places. But one thing is very important to talk about it. So the medical care is a very mechanical. We have this mechanical thing, you know. When sometimes I see patients and they say, well, doctor, I have some back pain. It's very common, you know. I have some back pain and I have this problem. Okay, I will prescribe some medication, anti-inflammatories and other stuff. You're gonna use that and you come back in 2 or 3 weeks just to see if you're okay. So the patient come back and he just say, well, it's not so good. I keep this pain and suffering about it. Okay, now I will prescribe other medication. I will put some morphine or tramadol or codeine is a more intense medication. Okay, you just use it and come back with the pain. You just keep the pain live. So what the problem about it? It's it's not so common the doctor talk with the patient without talking about pain. When you see the patients with chronic pain, we talk with them and we ask, well, how's your life? Your wife and your kids and your job, all of them have some problems. Of course, we have physiological problems. Sometimes you have some discopathy in your well, you listen me. Just to check here. Can you listen me? Just say here, just right here. Oh, okay, okay. I just keep all the everything is mute here. Okay. So the patient have these problems and have a problem to talk about pain. But when I start to teach, start to study hypnosis, I listen patients different. And for me, that's the big problems in medicine. We don't listen well. We don't listen really clear what the patients say. We just focus on disease, not in health. I work here in Curitiba. I'm an orthopedic surgeon. I operate patients, and I see them in a post-operative care. When I see them, when I talk with them, they suffer with anxiety. That's the problem number one in the post-operative care. Because before the surgery, of course, he have a lot of anxiety about it. He just asks, well, maybe I will die in the surgery, or maybe I will lose my function of my arm and my leg, or something like that. He have a lot of afraid about it. But in a post-operative care, he suffer about anxiety. When in the first day in the post-operative situations, the patient looked to me and say, doctor, everything is well? Well, I'm just talk with them. Well, don't worry about it. The surgery occur when we expect it. All the time we say that. Because if we have some problems, we just wait a little bit to talk with them. Because he is in a critical situation, very critical situation now. The first or the one or day two, we have a lot of problems about it. We need to give them some happiness, you know. You just need to keep them without afraid, you know. Just see that. Can you talk about the side effects of the routine medication? Of course, EV. Well, we have a lot of medications who we prescribe in a post-operative care for nausea, for pain. Is a very common we prescribe this medication because it's not so common use hypnosis in this situation. I use hypnosis when the patient is very with a lot of anxiety, and when he feel these side effects. You know, when I use a tramadol, it give a lot of nausea to the patient. We have a lot of nausea with this medication. So when we talk with patients, we say, well, we need to do something to solve that. We need to do something to solve your nausea. Of course, we can give other medications. It's more easy, it's more fast, but have a cost. Is a big problem, okay? So now I'm just teach patients, teach the health professionals to use hypnosis in these situations. It's a very simple routines. I use some PNL, LNP procedures because in Brazil we call it PNL. But LNP practice we can use, but I really love the classical hypnosis. When we use our imagination state, we can give to patient a possibility to put him in another place because he suffered. In a post-operative is suffering, but is a controlled suffering. Because when you do a procedure, we have aggression to the body, but is a controlled aggression. When you use the hypnosis in this post-operative care, we give them to the mind and to the body a possibility to recover fast, more fast. But you say hypnosis, we can use hypnosis to recovery fast than the usual. Let me explain better. When the patient uses hypnosis in a post-operative care, he just opened his mind to do the best of his body, the best. When he starts to recover with a lot of thoughts, negative thoughts, we have a lot of problems with the recovery. Have a lot of patients in a post-operative care who just stop it to think about his recovery and just think about the problems in his life. We need to do something to make him feel better, to have a better recovery. For me, every side effects, we can use hypnosis. Everyone. We have nausea, we have pain, we have a lot of things we can use hypnosis, but we need to have something called time. Of course, have a lot of fast approaches, but the patients responds different in this situation. They respond different. Hello, Angela.
Hello. I'm enjoying your talk. Oh, let me make sure my microphone is near. Can you hear me all right?
No, it's very clear to listen to you.
Beautiful. You're doing a great job.
Oh,
one of my questions on the anxiety, is it primarily the anxiety that you're using it for the hypnosis? Or do you also use it to speed up the healing? And how do you use it to speed up the healing?
Well, I'm a fan of imaginative things. I'm a very fan. And I always give to the patient the specific place to optimize his recovery. But I'm talk with the patient before all the situations, all the hypnosis, talking about the best places in the world he wants to be after the surgery. Places with his family or his dog, or any place he really wants to stay after surgery. When the surgery finish, I will talk with them I'm talk with the patient in a hippie. I don't know how I say in English this, but is the place who the patient go after the surgery, but it's not his room. Is the place
recovery.
Inside. Yeah, it's the recovery maybe, because in Brazil we call a hippie. So in this place, I'm just talk with him and say, well, the surgery doing well, and don't have any problem about the surgery, and I just want to do something you really love it. In this situation, I think this will make you feel better. Just close your eyes, have a deep breath, and just focus on a good place you want to be. Remember when you talk about this place, maybe he's talking about his home. Just go now in your imagination. Just go now. What do you want to see in this place? What do you want to feel in this place? So it's very common. He stay in his bed, and his family stay with him and say, well, everything's gonna be okay, and you are a very strong guy, you are a very strong person, and all the family talking about it with him, about his recovery. And all this imagination, good imagination, we see the effective in a post-operative care. We see his patient have a good recovery of the curatives. We feel that when the patient just feel better, he talking, doctor, I feel very, very awesome.
Nice.
I don't feel any pain. I'm very happy now, and I know it's gonna be okay. Everything's gonna be okay. So we see this. We don't have an infection. The possibility of infection is very common. But have other patients who don't want it. They say, doctor, I don't want to imagine in anything. I just give me some morphine or some medication, and I don't want to do that. Okay, don't have any problem. But this patient have problems. But for me, of course, have a lot of articles talking about it. But I see this experimental thing happen. I see that. When I use the arrow technique, my Freddy, my father, my hypno father, Freddy, when I use the arrow technique to talk, I'm just optimize. Wow, it's a very difficult thing to talk in English. When I change some things in arrow technique, of course, I use the arrow technique, but sometimes I use to entity, sometimes I use to other stuffs. The same protocol, you know. When the patient feel better with hypnosis, he wants more. He looked to me and say, "Doctor, do you do this thing about the mind thing? Do again. I really love it. Okay, let's do again." So it's a very I'm feel very happy to use hypnosis in the place who the patient have some good results, and it's fantastic.
I love having the actual experience. That is your actual experience in a hospital setting. That's phenomenal. That's wonderful.
And
Thank you.
is it, thank you about the question. And I feel very excited about it because now we have, of course, a lot of preconceptions about hypnosis. And I have a lot of friends who are doctors, and they look to me and say, "Stop to do this thing. Just stop it. It's so ridiculous." Okay.
Thank you
It's
for
very
carrying
ridiculous.
on and ignoring them.
Yeah. They don't want to see because they don't need to believe. But my friends, they need to just observe the phenomenon happen. Sometimes in ER, I work in ER too, and sometimes we have some cut, you know, in our arm cut, and we need to fix that, right? And sometimes I use some techniques. Sometimes I'm using a swallowing technique. It's an adaptation of Spanish doctor technique. And when I use the swallowing technique, it's very simple. Well, the patient just closes his eyes, and I say, "Well, just put some saliva in your mouth. Just accumulate saliva in your mouth, and just close your eyes and just have a deep breath. Only that. Just focus on that." So after we have a lot of saliva in your mouth, I just want to you. I need to you imagining the saliva have some anesthetic power. And in one time, you will swallow the saliva. And imagine that the saliva just go into your arm. And you feel the anesthesia in all of your arm. Of course, I use I talk in Portuguese. For me, it's very easy. And the patient just feel this phenomenon happen. When he's swelling, they go to his arm and just have some anesthesia. And after that, I say, "Well, now your arm have a lot of anesthesia. You can move, but you feel anything about pressure or pain. You don't feel that. You just feel your arm with anesthesia. I can do anything in your cut. You don't need to worry about it." So I start to wash. And after, I just put the medication with alcohol. And after that, I just fix. And the patient just looked at and, "What the fuck?" And it starts to and say, "Well, you don't use any anesthesia." And I say, "Well, you're not right. You're wrong. I use anesthesia, but your mind just do that." Sometimes some colleagues, some other doctors come to the room and look at and say, "You do that stuff again? You do that stuff? Hypnosis is wrong. You don't need to use that." But look the situation. The patient have anesthesia. He don't feel any suffer. He don't have any pain. And the postoperative situation is a very, very better.
No side effects.
No side effects. But my friends look at it and say, "That's wrong. You need to use anesthetic. You need to use it. It's protocol. No, you don't need to use that. You can use, of course, I have other situation who we can use. In kids, it's very simple to do anesthesia. Very, very simple. And don't have any side effects. And it's a very common, where I just say to patient, well, you need to come back in 2 weeks to just pull out the stickers. You just need to pull out in 2 weeks. Okay. But sometimes it's very common. After I use hypnosis, he come in 1 week.
Nice.
It's fantastic. But other medicals, other doctors don't look that. Not the doctors, just the nurses, physiotherapists have a lot of people who have a lot of preconceptions about it and don't want to see the phenomenon happen.
Are you writing down the dates that this is happening to keep a record of it?
Yeah, I have some records about it. With my patient in a hospital, we have the, I don't know what I say in English. Well, we have this records of the patient.
Beautiful.
Prontuário. In Brazil, we call it prontuário. And it's a medical records. So everyone I use it, I just assimilate with, well, I use some technique and I have these effects, have this phenomenon, have these results. So I have that. I use, well, I work with hypnosis in a medical situation. I think in 3 years. I'm starting 3 years ago to use that. And I think I have a lot of patients, but I don't have the exact number. But
no, but the records will help.
Maybe one day I can. I will use all of that, all this information, and start to produce some articles or something like that.
Perfect.
Flavio, can I?
Because in Brazil we work a lot than a doctor, you know. Is a difference in I think in England or other places in the world. We work a lot here, so we don't have so much time to start these articles or just write these books or something.
Flavio, can you hear me?
Yeah, I can hear you very clear, Freddy.
We were speaking a while back in London, and you were telling about the recovery rate coming down from something like 45 days to 35 days, having used hypnosis in your orthopedic surgery. And also about the fact that I think at the time, it might be different now, but at the time, when you've been using hypnosis, you'd had 0 infections in your patients. Is that true? Is that still the same?
You know, it's very difficult talking about 0, you know?
Yeah.
Because we talk about medicine. In medicine, always we have one or two patients who don't, we really don't expect, but just have some infection. But we can decrease a lot of the infection in the postoperative care using hypnosis. You know, when we're talking about bone recovery, we have 45 days we need to recover bone. We start to recover the bone after a fracture, and hypnosis don't optimize the time of bone recovery, but all the tecidual issues, muscles and skin and all things without bone, we optimize. We have a fast recovery using hypnosis.
That's fantastic. Yeah.
Only using imagination. Sometimes ankle fracture. Let's imagine that. We have an ankle fracture. When the patient in a postoperative care, he's in the room, and I go there and I say, well, I just want to do a very, very simple imagination protocol. Very simple. The patient all the time he say, yes, let's do that, because they really love it. And when the patient closes his eyes, I just pull him in a situation, who he start to imagining his ankle. He starts to imagine his ankle, your ankle. Go there. If you are a small cell, what you can do now? You are a small cell. Go there. And his patient, and the patient, with his imagination, he's imagining he's a cell, and he go there. Well, now you can feel the situation. We need to recover your ankle. Now you need some help. What are you gonna do? You need to call other friends, maybe other cells. Maybe you can create other clones of you. Now imagining you just create other you, other cell. And now any one of this cell create other two, and just expand the cells, good cells with a lot of health, with good recovery. Go there and start to work. Everything happen in your ankle. It's very focused. We can see when the patient keep his eyes closed. We can see sometimes the fingers and his foot just do this, a small thing, you know, just a small moves. You look at. Sometimes he move more. Sometimes your ankle just move. And when you use we increase the suggestion about now you feel some liquid get inside your foot, inside your ankle, and you feel this recover all the external parts. Your skin start to recover. We see the move of his ankle, his foot, and the fingers just move it more fast. That's fascinating because he don't feel that. When the patient opening his eyes, he say, well, I feel some paresthesia in my fingers. I feel some paresthesia, it's strange. Sometimes I say, well, if you feel that, you can optimize this phenomenon. Close your eyes again. And now I just want to imagine you move your ankle. But he don't. Just imagine he's moving. And now just move more, with more intensity. You see the small movement in his foot, in his fingers. That's fantastic because something happened. We don't know what, but something happened. A lot of people thinking about the influence of cortical structure in our brains with hypnosis. For me, is a more intense, the cortex activation when you're talking about orthopedic situations. Because when you use specific suggestions to the patient to move his arm, to move his leg, or move his back, you know, we see a lot of activation in MRI, functional MRI in some articles, but we see these small movements of his muscle. That's a fantastic thing. Something has happened, but we don't know what yet.
That's fantastic. The other thing, when you first started speaking, you were talking about post-operative care, and you were saying about, you didn't say it in so many words, but talking about the importance of hope. I believe that's what you were talking about, hope in recovery. And I've read this somewhere that medication might not always be necessary, but belief in a recovery is. How strong do you think that, how important do you think that is? And how do you think that hypnosis, where hypnosis comes into? I know you were saying about, you know, imagining yourself out there like what we'd call a future pace. see yourself out there recovered, living your life well. How important is that in post-operative care?
It's very, very, very important. Well, I will explain what I do with my patient in this situation. My protocol, my complete protocol in these situations. When the patient have indication to do surgeries, to have a problem, and he need the surgery, start a psychological talk. I'm asked, what do you think about the surgery? You think is it very important or not? What do you think you're gonna feel in all the situation? You feel afraid of something? You feel worried about something? If a worst thing happened with you, what do you feel about it? You're gonna feel, what are you gonna feel if you lose your leg or lose your arm? I'm asked a lot of things. I just start to activate a lot of places in his brain for imagination. When I finish that, I'm talking about this surgery. Well, we're gonna do this and that and this and that. And the surgery happened in this situation. We have some risks about it because we need to talk about it. We need to explain that. The patient needs to know what will happen. But after I talk about the surgery, I'm talking about, well, this information is in the books. Now I will talk about my perspective about the surgery. When you submitted to a surgery, you need to understand the most important thing is your mental position, your mental dynamics. You need to have in your brain, in your mind, good thoughts, good perspective. You need it. If you don't have in your brain, in your mind, positive thoughts, if you have just negative thoughts, just problems, just worries, if you have this in your mind now, we have problems in the surgery. So we need to optimize, we need to increase your good, positive thoughts. What is the positive thoughts for you? What's the best thoughts you have in your mind? It's your family. In Brazil, we have emotional things. It's a very emotional here, the people. So your family is important for you. Okay, yes, you have kids? Yes. Remember when your first son born? Yes. In his mind, now have a lot of positive thoughts. Remember the good places, good situations, good information. When he put some serotonin in his brain, we start to, well, now we have a situation to fix, is your surgery. But if your mind is prepared with the good things, we have good results. And the patient accept that. He say, well, I'm with you. I will start to use my positive thoughts all the time. Okay. When you go to the surgical room, I'm talk with him and say, well, I know you are ready. Sometimes you're not, maybe you feel you're not ready, but you are. Because you have the power of your family, your good things, your good thoughts. All of that is your mind. And you need to feel that. In this situation, I just close his eyes and do a Elman induction. After that, I put him in a good place, in a safe place. In this moment, the anesthesiologist use the medication. Because in Brazil, we have some laws. We can use just hypnosis to do big surgeries. we need to use chemical anesthetics. But the patient feel better in this situation. He will sleep with the medication in safe place, in a good place. Okay, we do the surgery. When it's ended, the patient wake up, and the first person he see is me. And when see me, he remember all the thoughts before the surgery. And his brain just keep these good thoughts who he's just used before the surgery. And when he opened the eyes, he looked to me and say, well, the surgery is over. Yes. Everything's okay? Yes, everything's okay. But we're talking about surgery after. You don't need to worry about it. I'm worried about your recovery now. So let's do other things. Other exercise. Close your eyes and do an Elman induction. And after that, I put the patient on his Dale state. He just will wake up in his room, sometimes 1, 2, 3 hours. I see patient just wake up 6 hours after surgery in his Dale state. Because the first day, the first 24 hours is very important in this recovery, in his recovery. Because the cells is a little bit confused about what happened. What happened? What surgery happened? We need to go there. We need to fix that. It's a big surgery. We need to go there. After the first 24 hours, we have some body organization. But if you have negative thoughts in this situation, we're gonna just embarrassing all the situation. The cells will have other stimulus. They will stimulate it for other things who the negative thoughts created. So if we have positive thoughts, we keep our body clean to just focus on recovery. So a lot of people say, well, hypnosis increase our recovery. It's not right. Hypnosis just put our body in a perfect situation. It's not a magic. It's just a physiology, only physiology. When you have a good results in your recovery, your body starts to, he's want more. So the negative thoughts go away. Maybe this surgery is the start point of new life, because he now he knows what he needs to do to have a good thoughts. And these situations are very common, because sometimes patients come back in a 2, 3, 4 weeks. He come back to me and say, doctor, I don't know what happened in the surgery. I feel fantastic. But the big difference is I'm stopped to smoke. I can talk with my wife without fight. I can listen my sons. I can listen my kids. What happened? It's just positive thoughts. We use these positive thoughts to have a good results in surgery, but now he have a good results in life. We can separate the medical care with the life. We can separate, because in this situation you have an opportunity. I see a lot of people die in my life, but when the patient have a new chance, or he have a lot of afraid to die, maybe it's a small surgery, but he's have a lot of afraid. You say, sometimes we're gonna just take off a little lesion in the tendon or in the skin. patient go to the surgical center and say, "Doctor, I will die." Of course not. But it's an opportunity to change his life. So for me, the post-operative care is a very, very important. Because before surgery, the patient don't know what will happen. The doctors have know what will happen, have a big probability to have happening something after the surgery. But when the surgery ends and we see the patient, we see physiology, and we see a person who needs something in mental situation. It's not so common we see the patient after surgery look to you and say, "Doctor, I know my surgery is fantastic. I feel fantastic." We can see that. It's not common. It's not common. When the surgery ends, the patient look to you with afraid. He looked to you and say, "Please help me. Please do something for me because I need you. I'm hopeless. If you want to kill me now, you can, because I don't have any defense." He's just a small guy. We need to just grow him. So for me, is a very important thing to use in the post-operative care. Freddy, you here? Talk too much?
I'm here. No, I've been listening. It's fantastic. I'm getting a bit emotional, to be honest with you, to think that how you can, but would you say there is a difference though between actually, using hypnosis to put someone into hypnosis and just asking them to think positively?
Yeah.
What do you think that difference is then? You think, what is it that makes the difference between, some surgeon just saying, "Look, think positively," and someone like yourself saying, "Look, close your eyes," and then doing an Elman induction? And do you call it hypnosis, or do you call it something else?
Well, for me, the positive thoughts is just the car.
Yeah.
The result is the end of the road. Sometimes we say, "Well, just think well. Just think of good things." It's a very easy to talk. It's a very hard to the patient. Do this without help. We need to guide the patient. We need to guide him. Because when you say, "Oh, well, have a good thoughts," he go to surgery. Sometimes you have a pain. You have a fracture. You have a lot of problems. And you say, "Well, just have a good thoughts." It's a very easy to us say that. But we need to guide them. We need to find the places, the situation who make his feel better. That's for me, is the big thing about hypnosis in these situations. We need to guide. For me, hypnosis is associated with we guide the patient.
Yeah, I totally agree. I totally agree. Yeah. No, that's fantastic. So, do you give them any kind of self-hypnosis tools to take home with them for any pain they might experience, in the recovery? Do you give them any kind of self-hypnosis tools to do that? Do you teach them anything in that way?
Yeah, I'm always teach my patient about self-hypnosis because, it's my way to see these hypnosis situations. I don't want the patient come back to me every moment he needs to use hypnosis. I just want to use hypnosis with him once. I just want to teach him once. And after that, I just want to respond to his questions.
Yeah, I mean, it's a way of empowering your patient, isn't it? I do that with all my clients. That's, you know, it sounds a strange thing to say, but I often say I don't want, you know, I hope I never see you again, which is a strange thing to say as a therapist. But, you know, I teach them how to do self-hypnosis so they can continue with that work on their own. And I can totally understand how, you know, you teaching your patients how to utilize it when they get home to increase the recovery. I think it's a wonderful thing to do.
Yeah, we can give to them some guided audios about hypnosis, about phenomena they can use in situations. But for me, it's more effective if he really understand what is hypnosis and how he can use in his life. Because sometimes this talk I have with Dan Clearly the last year in UK Hypnosis Convention with Dan Clearly, talking about pain, chronic pain, and self-hypnosis. Well, we're talking about the use of self-hypnosis and the importance to teach the patient and transform them in a gun who will put hypnosis in any place he see. Because the big problem about chronic pain or these problems after the surgeries is in my vision, is the patient who needs to use other professionals to fix his problems. And he can use hypnosis to fix these problems. Of course, if he have some infection who needs antibiotics, he needs to go to the doctor. But if he have pain associated with emotional stuff, if he knows the power of hypnosis and know the techniques, he have a possibility to use that and have a good results. Well, when the patient go away to my office, into the hospital, I say, well, let me teach you a small induction, a fast induction. I'm teaching him about Elman induction. The patient really love it to use that.
Yeah, I mean, I think the saliva, we spoke about that in London quite a long while ago, and you were talking about that as a way of like anesthesia. And I just think that's the thing. In fact, I've done it for myself while we were talking. I had a bit of a toothache, to be honest with you. And so I thought I might as well just try it, what you were saying. And I'm talking now and I haven't got that pain. So I don't know. It's a crazy thing, isn't it, to think, you know, when you explain to people about having, you know, stitches put in your arm or an injection or any other kind of what I'd call small interventions. I'm not talking about having a leg taken off or bones fixed, but, you know, having stitches or having, you know, having a tooth removed. That simple thing that you were talking about earlier, it sounds incredible, but, you know, I've seen incredible things and you've seen incredible things with hypnosis. But to say to someone, look, just close your eyes and just, you know, let that saliva build in your mouth. And when you swallow, imagine it's going to that place where you want the anesthesia to be. I think that's a wonderful thing. I think if you haven't put your name on that, I would put your name on that. You know, the Dr. Flävio anesthesia technique. I mean, it's just beautiful. It's so simple. You know, it is. It's fantastic. But when you think, I mean, I remember thinking, you know, as children, we hurt ourselves, and our mothers say, "Well, come here, I'll kiss it better." I believe there is a certain amount of anesthesia and antibiotics in our saliva. Is that true? I mean, I don't know. I seem to have read that somewhere or heard that. That's where that saying came about. Let me kiss it better. Because there is a certain amount of anesthesia. I might be completely wrong. It might be complete, you know, old what's the word I'm looking for? Old wives' tales. But when you think about it, and if someone has heard that, like I have, and there is that thought in my mind, well, maybe there is a certain amount of anesthetic quality to our saliva. And a doctor, you know, a man in a white coat says to you, do this. He's got a stethoscope around his neck. You know, there's obviously an authority as well. So all of that together, I think it's amazing. Yeah, I'm gonna do that with a few people. I'm gonna
Just
nick
try
that
it.
off. I'm gonna nick it off you, and I'm gonna use it. Don't worry.
Okay.
But no, fantastic. But you know, these things that you're talking about, and I can imagine in pre-operative care, you know, to using hypnosis to alleviate the anxiety, which is what you were talking about, which is a major thing. You know, anyone's going to go under anesthesia, going to have an operation. There's bound to be a major amount of anxiety, and going into that without that anxiety is a wonderful thing to do for people. You know, I love what you're doing. You know, and if I remember rightly, when we first met, you had a pain in your knee, and that when we had that meeting together in that conference room. Do you remember for the first time?
Well,
In
I,
Bella Horizonte, when you were in my class and you had a pain in your knee. I think that was the first time you experienced hypnosis for pain control.
yeah.
And now you're teaching people. Now you're helping hundreds, thousands of people. It's fantastic. You know,
I remember the first time you used the arrow technique in Marcella's knee.
yeah,
You remember that?
yeah.
It's a very funny day.
And now,
because,
you know, yeah, go on.
because in this day, I didn't have a good results using hypnosis. And after you do it with Marcella, I looked at it and say, well, if you work with her, maybe I can use with anyone. Because it's a very funny. Marcella's have a chronic knee pain. She don't have it anymore, but she have a knee pain, chronic knee pain, and I'm orthopedic. It's funny.
Yeah.
I can fix this problem.
No, I mean,
her problem.
but you know, I think, you know, when we say, you know, pass on the love, you know, to think that I know you're using loads of different techniques and using your own, you know, the Dr. Flävio technique for anesthesia, which I love. You know, and it's a fantastic tool. And to hear someone of your sort of caliber, because when we're talking about, in general, we're talking about hypnotherapists who are lay technicians, if you like, you know. I don't have the qualifications you've got. And for you to be keeping, as Angela was saying earlier, for keeping records, you know, the evidence will build up and build up. And you're teaching nurses and doctors now to use this. And if all of those people keep records of recovery, that goes a big way towards, you know, acceptance of hypnosis in the medical field. So you're doing a fantastic job. Anyway, I'll let you get back to it. I'm talking enough now, so I'll let you get back to it. But you're doing great. It's fantastic. I'm loving it. I'm sure everyone else is listening is loving it as well.
Thank you, Freddy. Thank you. Well, have other questions here. Have a Danyel Degenhardt. I think is I think is that. Well, I will open the mic. Okay. Hello, Daniel.
Hi. This has been really great. I've already written down 4 pages of notes. I'm a physiotherapist that was trained in Canada and living in New Zealand. And I've been looking forward to hear your talk because I just got qualified. I've been learning hypnosis for a couple of years, but I just got qualified in the last couple months. And I got approval from my licensing board to start using hypnosis. So the last couple months I've been using techniques with my patients and having some really interesting results. So I had 2 questions for you. One is, do you always call it hypnosis, or do you sometimes just guide people into those experiences? That's the first question. And the second question is, how do you explain hypnosis to your medical colleagues?
Whoa, it's a fantastic questions. Okay. Well, I will start with the second one. Okay. Well, we here in Brazil, I don't know what happened in Canada about it, but here in Brazil, we have a lot of problems to explain hypnosis because a lot of people here see hypnosis than a mystical thing, very mystic. So we have this big problem. And we have some TV shows who show hypnosis to some shows who explain hypnosis just with horrible exercises. Just and they see mind control. He can lose the control, or eating an onion, think is an apple. The people don't like it. It's good to see the people. Whoa, it's fantastic. But with me, no. Don't look to me. I don't want to participate of that. When you talk with the patient or you talk with anyone about hypnosis, they come to his minds these situations. That's horrible stuff. My friends, in the beginning of my career, they asked to me, well, you started to hypnosis. Now, yes, I'm started. But you don't have any shame about it? Why? You a doctor. What the fuck you doing with hypnosis? That's a horrible thing. Why do you do that? Just focus on your medical situations, your medical training. Don't do that. Don't use that. The people will look to you and think you are, in Brazil, we call a charlatão. Is a guy who just use I lost the word. Well, the people don't believe me. Well, hypnosis is a ridiculous thing. My friends don't look to me and say, I don't believe you. I don't believe you. But say charlatan. So also, okay, it's always charlatan. And when I start to use hypnosis in a medical situation in an ER, they see the phenomena. Of course, I don't use in the patient in the beginning. I use with nurses or other people who work with me. They say, well, you do hypnosis. Hey, I want to understand that. You do with me. Okay, let's do something. Just close your eyes and do that and do that. And sometimes just the lock fingers, you know, and say, well, I can open my fingers. Oh my God, I can open my fingers. Okay, now you just open your fingers and you're stuck in your foot. Stuck. Okay, oh shit, I can, inside in the hospital. So my friend looked at that and said, don't look to my eyes. Get out of here. I don't want it. Sometimes we have a lot of anxiety situations in ER. The patient come with that, like that, because he have a discussion with the girlfriend. And it's very common, of course, in the beginning of my career, my medical career, I use a medication, some diazepam or clonazepam IV, and just relax the cars. I use this medication in the beginning. After I learn hypnosis, when a patient come like that, I'm go with him, I'm sit beside him, and I started. I'm looking in here, and I see you're suffering. We can use medication, yes, but have other thing is a very, very, very intense and fantastic. But you need to trust me and do what I say. Well, I have some, I forgot the word, because I use a medical thing, you know. I'm a doctor, I have authority, so it's more easy for me. And I have a authority, so I go there and say, well, you do that. And I use hypnosis. My friends, my doctor's friends, looked at that and say, well, what the fuck is doing in heaven? Confession. That's amazing. So some friends just say, okay, it's a good thing, but I don't want to listen to that. Okay, no problem. But other friends say to me, well, I want to teach that. I want to learn that. Please teach me. Okay. So I'm talking about phenomenal. I'm always talk about hypnosis, about phenomenal thing. If you get inside in articles thing, we have 50,000 articles talking about hypnosis. It's a lot of articles talking about hypnosis. And when I explain to doctors, my friends, about hypnosis, I say, well, let's keep in phenomenal things. When I do some small anesthesia, sometimes I use the clips, you know, to put in a skin. I never use needles because I don't like aggression, penetration. I really don't like it, and I don't use that in demonstration. Anything who have a penetration in the skin, I never use that. But when we have I use a clip or something like that, and I put in the skin in a small technique of anesthesia, they look at and say, what the fuck? But I always say to them, well, just focus on phenomenon. Just focus on phenomenon. For me, that's the phrase I always use in the hospital with my friends. Just focus on phenomenon. What explanation about hypnosis? I really don't know. We have a lot of things we're thinking about. Well, we have some amygdala interpretation. We have some association with cortex. We don't know. We don't know. We have a lot of functional MRIs showing about fibromyalgia, the activation of some places in the brain who using hypnosis in fibromyalgia. But we don't explain hypnosis. We have some activation in MRIs, in electroencephalograms, who show something, but we can interpret that yet. Maybe we will die when they discover. But I hope we have an explanation about hypnosis. And for me, it's a future technique. It's a future technique.
What I've been saying recently is the problem we have with explaining hypnosis is that hypnosis, as you've been saying all the way through your talk, utilizes imagination. And I think we accept that imagination is created by the mind. But the mind doesn't exist as a tangible thing. No one's held a mind in their hand. No one's ever seen a mind. You know, so the mind only exists as a concept in our imagination. So if hypnosis utilizes imagination, and imagination is created by the mind, and the mind is just a concept in our imagination, you can see how complex it is to try and figure out what hypnosis is. I think my feelings are this, and I'm sure you'll when you think about it, you'll agree. I hope you do anyway. It is a natural, it's a heightened natural learning state. It's an ability to take on board a learning, a new way of thinking rapidly. You know, the ability to, when we describe how there are times when we just don't feel pain. We know that if our life is under threat. Recently, I've been saying to people who come and see me for pain, I said, if your child was about to step on the street, step into the traffic, where would your pain be? You know, they might not be limping. They might have terrible backache. They might have a terrible pain in their leg or their shoulder. And I say, you know, if your child was just about to step into the road, where would your pain be? And they say, I wouldn't have any pain. So we know that there is certain situations where the mind or the brain will shut pain off if it's that important, if our life's under threat or the life of someone we really love's under threat. So I think all we're doing as hypnotists or hypnotherapists is somehow tapping into that unconscious ability that we all have. And once that understanding, like you say when you treat your patients, your post-operative care, when you say, imagine your life, you know, living your life and being happy and watching your kids growing up and being with your wife and achieving the things you want to achieve, when they're thinking that, their body is adjusting accordingly to that outcome. Maybe that's my simplistic way of thinking, but we're never gonna. I don't think they're ever gonna truly explain what hypnosis is. That's my thoughts. We can look, as you say, at MRI scans. We can look at the brain technology, all of that kind of thing, and we can see different areas of our brain working. But sometimes we have to accept that as human beings, there's more to us. And you as a surgeon, I mean, you work physically with people on broken bones, and yet you've seen changes in people and faster recovery just by positive thinking. And sometimes we have to accept there are more to us than just flesh and bone, and our ability to heal is increased by how we think, which is what you're doing. It's brilliant.
Thanks, Freddy, for that, and Flavio. You answered the question in a really interesting way. And I actually have to go, and I'm seeing a patient that I've done some hypnosis with just last week, so I'm interested to see his results. I'm definitely going to keep in touch with you, Flavio, though, and talk to you about a rehearsal technique that I used with a patient going into a cataract surgery who had anxiety 7 out of 10, and after the 10-minute technique felt great, and then came back again for the next technique for her other cataract surgery. So I can see how this can be beneficial, and definitely want to continue that conversation more. So thank you guys for that. I got to head out, but I'll probably watch the rest of the recording. So
keep up the great work, Daniel. Keep up that great work.
Appreciate
it. All right.
Hopefully Anthony and I are coming out to Australia and New Zealand in March, I hope. Hopefully I'll get to see you. It'll be fantastic.
All right. Take care.
Take care.
Excellent. Bye-bye, Daniel. Thank you. Well, I think that if anyone have other question, Freddy, maybe you have other question.
I just like to. I'm going to come back on video so you can see how rough I look at the moment.
Okay, always good to see you.
I just want to thank you, Flavio, for doing this for us and doing this talk for us. We have a great group, this discussion, that we have, this Freddy Jacquin Hypnosis Network, and great people like yourself giving you time to teach us. And I'm sure there are a lot of people out there like myself who have learned a lot from you. The saliva technique, I'd like to think that anyone listening to this and the people who are going to watch the recording are going to try that on their own self as a self-hypnosis tool. I just think it's phenomenal. It's a very simple and easy thing to use. But then most of the things that work really well are simple, and I'd just like to thank you from my own heart and from all the people you're helping. I love you. And Marcel,
I know. I love you too,
I love you, and Marcel. You're some of my hypno children. So give my love to Marcella, and thank you again from everyone that's listening and everyone that's watching. And I'm sure if anyone wants to ask any more questions, post them on our Hypnosis Network, Freddy Jacquin Hypnosis Network thing. I'm sure that Flavio will answer them. But I'm recording this, so we'll better go and revisit this. And as I said, thank you from my heart. Thank you from everyone that's listening. And I look forward to seeing you in Las Vegas, if not sooner. Okay?
Yes. It's going to be fantastic to see you and Anthony again. So thank you, Freddy, for your invite. I'm very happy to participate of your Freddy Talk. And I just keep my English study. So I'm optimizing my English well, and because we don't use so much English here, but we'll keep my studying in English and to talking better.
Your English is great. Let me say, it's 100 times better than my Portuguese. So,
but your Portuguese
I've understood everything you've said, and I'm sure everyone else has as well. So, it's been brilliant. And as I said, love to you both, and keep up the great work. Okay, and I'll speak to you again. Thank you
Thank
again.
you,
There's one more
Freddy.
question down there, but I don't know if you've got time to answer it. Oh, she's just saying thank you and good night, I think. So anyway, I'll speak to you soon. Take care. Bye.
Yeah, take care of you. Thank you,
Bye
and
for now.
Freddy and Anthony. Bye-bye.
Bye for now.